So hello everyone, my name is Joanna Moncrieff. I'm a professor of critical and social psychiatry at University College London, and I also work as a practicing psychiatrist in the National Health Service in London. And I'm going to talk to you today about the idea of the idea that mental health problems like depression are due to a chemical imbalance. And I'm going to tell you what we've found in our research that suggests that that is not the case. And I'm going to think about the implications of those findings for how we understand and should use drugs that are prescribed for mental health problems. So the idea that conditions like depression and anxiety and psychosis are caused by an abnormality of a chemical in the brain, a theory that became known as the chemical imbalance theory of mental disorders, started back in the 1960s. There were also suggestions that the brain chemical called serotonin might be relevant in depression and might be a feasible target of drug treatment. And in the 1990s, when a new range of drugs were brought in for the treatment of depression that targeted the serotonin system, this idea that depression was caused by an abnormality of serotonin was revived and publicized in a massive publicity campaign that was organized by the pharmaceutical industry in the context of trying to sell their new range of antidepressants. Now, the pharmaceutical industry needed to spread this idea at that time because during the 1980s, before the arrival of the SSRI antidepressants, during the 1980s, the most widely prescribed drugs were drugs called benzodiazepines. That they are drugs, that is the class of drugs that includes drugs like Valium, that is diazepam, and Librium, and lorazepam, also known as Xanax. These drugs were being very widely prescribed at that time. And when it was discovered that they were actually as addictive as the drugs that they had replaced, even though initially people had been told they were not addictive, a big scandal erupted. And it became clear that many millions of people had been placed on these drugs to blot out their emotional reactions to difficult circumstances, particularly women who were struggling with the job of bringing up children. And so that scandal brought the idea of using drugs to dampen down our emotions into disrepute. And so the pharmaceutical industry needed a new narrative with which to sell its new drugs. And so that's when they really took hold of this idea of the chemical imbalance and popularized it. And so the publicity that went along with the marketing of the SSRIs told people that depression was caused by a lack of serotonin in the brain, and that happily this could be rectified by taking a serotonin boosting antidepressant, in other words, one of the selective serotonin reuptake inhibitors, the SSRIs that were being marketed at that time. And this message was also promoted by psychiatric organizations like the American Psychiatric Association, the APA, and also the Royal College of Psychiatrists in the UK. And this message was promoted even though it was not clear that there was evidence that really supported the theory, the idea that there was a lack of serotonin in depression. And although the message went on being publicized and most people came to accept that it was true, and many doctors told their patients that they had a chemical imbalance and they needed to take an antidepressant to put it right, it was admitted by leading psychiatrists as early as the 2000s that actually the evidence base for there being an abnormality in depression was not very strong. And therefore, I thought it would be useful to really get all the research on serotonin and depression together in order to have an overview of whether this idea that serotonin, that depression is caused by a deficiency in serotonin is correct or not. So together with some colleagues, we identified the main areas of research that have looked at whether there are links between serotonin and depression. And what we found basically is that in the 5 areas of research that we looked at, there was no convincing evidence that there is any link between depression and serotonin. And certainly there was no evidence that depression is associated with or caused by a deficiency of serotonin. And the other interesting finding was from the genetic studies. These studies were very large, very well conducted studies. And the larger the studies got and the better conducted, the more convincing was the fact that they had negative findings. But they also found very strong associations between adverse life events and depression, which confirms a lot of other research that shows that depression is more likely in people who have had difficult upbringings, difficult lives to deal with, and are in difficult circumstances at the current time. So that is what we found, and it's been the reaction to our findings has been very interesting too. So a lot of psychiatrists have been very angry that we have drawn any conclusions about antidepressants, and they are suggesting that it doesn't matter how antidepressants work. We know they work. That's all that matters. And if they don't work through serotonin, they probably work through some other similar sort of mechanism. But this is very misleading. First of all, because the evidence that antidepressants work is debatable. But the other thing to consider is what we really mean when we say that antidepressants or any other drug for a psychological condition works. What do we mean by work? Now, the drugs that we prescribe for psychological problems are drugs that do affect the brain. They change the normal state of the brain. So if you give them to someone who doesn't have a psychiatric problem, they will also feel different. They will also experience the effects of these drugs. We sometimes refer to drugs that affect and change the normal state of the brain as psychoactive drugs. And it is worth thinking about and comparing the effects of psychiatric drugs to some of the drugs that we commonly think of as psychoactive drugs, like, for example, alcohol. We know that when you take alcohol, it changes your mental state, it changes the state of your body as well. And if you're feeling very unhappy or anxious before you take the alcohol, the effects of the alcohol can sometimes replace those underlying feelings so that temporarily you no longer feel unhappy or anxious or distressed. We have an expression for this situation, which is drowning your sorrows. Now, psychiatric drugs, I suggest, work in the same way. They change our normal brain chemistry, and therefore they change normal mental states and feelings and behaviors. And sometimes I would say that those effects can be useful. If someone is going through an acute psychotic episode and is really distressed and really preoccupied with what's going on in their head, then a drug like an antipsychotic that has both a sedating component and an emotional numbing component can help reduce the intensity of those experiences, and that can be helpful. But it's really important that we understand what we're doing when we're using these drugs, and it's really important that we are not misled by this idea that they are rectifying an underlying chemical imbalance or any other underlying abnormality. So it's really important that people have that information about drugs, that people understand what they are taking when they take a psychiatric drug. If you are told that you have a brain disease, essentially, that you have an abnormality in your brain of your brain chemicals or of your brain connections or of any other sort of biological process, and you are told that we have a drug that can put this abnormality right, then of course you're going to take that drug. It's a sensible thing to do, all other things being equal. And you don't think too much in that situation about the harmful effects that it might have, because it's putting something right after all, and you've got something wrong with you. If instead you understand that these drugs are actually changing the normal state of your brain in ways that we do not fully understand, then it rightly becomes a more worrying thing to do, and especially to do on a long-term basis. So we recognize that using other psychoactive drugs like alcohol, like heroin, like cocaine, on a continuous basis, day in, day out, for months and years, can cause us harm, can cause changes in the brain that cause dependence. The brain gets used to having the drug so that when it's stopped, people go into withdrawal, and can cause other problems. So we recognize those hazards when we talk about recreational drugs. And we need to recognize those hazards when we think about the use of psychiatric drugs too, because they are doing essentially the same thing. So we particularly need to be wary of the effects of taking these drugs for long periods of time, because we know that the brain changes when there is a drug present in it. It changes from its normal state, and therefore people experience withdrawal symptoms when they stop medications. And we know that people who've been on antidepressants for significant periods of time many of them will experience withdrawal symptoms, and about half of the people who experience withdrawal symptoms will find these symptoms to be really severe and impairing and disabling. And we also know that with some drugs, including antidepressants, there may be some lasting effects from using them long term. So the withdrawal symptoms don't, in everyone, just go away as soon as the drug is out of the system. In some people, they are persistent. They go on for long periods of time. And this suggests that the drugs have altered the brain in some persistent way, possibly some permanent way, although it does seem that eventually most of these people do improve, if not recover completely. And we also know that some people who've taken SSRI antidepressants in particular have long-lasting sexual dysfunction after they stop taking the antidepressant. So coming back to the effects of this idea that psychological problems are due to a chemical imbalance or some other brain disorder, brain disease. There has been research that shows that people who think that their depression is due to a chemical imbalance are less optimistic about their chances of making a recovery, and have less confidence that anything that they do themselves can help them towards recovery. And I think this just illustrates how disempowering this message can be. So it obviously has some welcome effects to be told that the problems you have are not your responsibility. There's something to do with your brain. It's not your fault. It's not part of you. It's part of your biology. But it's also a very disempowering message, because it means that you can't change it, that you have to be reliant on a doctor with a medicine or some other invasive technique to change the way that you are. And actually, it seems that rejecting this idea and accepting that this is part of how you are, and that you can in fact do some things to change it, is ultimately a more empowering message, although it may be a more difficult one to begin with, to accept to begin with. And people who, I did a study on the people who'd written blogs about their experience of having depression. And it was very clear that when people wrote about recovering from depression, they wrote about it in this empowered way. They wrote about how they had made changes in their lives and made changes in themselves. They had had to reevaluate their priorities, for example. Some of them recognized that they were working too hard and that this was not bringing them satisfaction in life. Some of them recognized they were in the wrong job and they needed to choose to change and do something else. Some of them recognized that they had long-standing relationship difficulties that they hadn't wanted to face up to, and that when they did face up to them, eventually they were able to overcome their feelings of depression. So it is an empowering message, ultimately, I believe. The other thing that it illustrates is that our mental health problems, and particularly things like depression and anxiety, are a response to our current circumstances. That's what emotions are. Emotions are a response, a particularly human response to circumstances, and depression is a response to difficult circumstances that make us unhappy. And therefore, we need to see depression and anxiety as signals that something needs to be changed in life. Of course, people are different, and people have different proclivities towards emotional reactions. So some people will respond more strongly to a situation than others will. And the way that we respond, the intensity of our emotional responses, is shaped by our personality, and that is shaped by all the experiences we had during our development, as well as to some extent by our genetic makeup. So that people who've experienced really difficult childhoods with abuse and trauma are more likely to suffer from depression and to have negative emotions when they get older. And this is why psychotherapy can be helpful for some people, because it enables people to develop, to reflect on why they might have difficulties managing their emotions, and to find more adaptive ways of managing them that get them into less difficulty. So I'd just like to add a little bit more about the process of coming off psychiatric medication and the sort of decisions that have to be made, because I'm aware that many people watching this may be taking psychiatric medication and may therefore be worried and be questioning what they're taking and wondering about what to do next. So the first thing I would say is that don't take psychiatric medication unless you really need to. Don't get onto it unless you really need to. And if you feel you really need to, take it at as low a dose as possible for as short a time as possible. And the time is the important thing. Because the longer you're on something, probably the more difficult it is to get off it. But for those of you who have been on medication for some time, I think people really need to weigh up what they think the medication is doing for them at the moment and what it's not doing for them, in the light of what I've said, in the light of thinking about these drugs as drugs that change our normal mental states. So are the changes that you are experiencing helpful to you or not? And if you decide that they're not, and if you decide that some of the changes you're experiencing might be positively harmful, like if you're experiencing some cognitive impairment or some sexual dysfunction and you want to get off the medication, there are a few points to bear in mind. First of all, don't take this decision suddenly. Talk about it with people, prepare for it, and find a mental health professional who's going to help support you through it. Secondly, do it slowly and do it carefully. And the really important part to do slowly is when you get down to the lower doses, because the low doses of drugs have much larger effects, relative effects, than additional doses. So it's when you get down to those low doses that you need to go very slowly and carefully. And for someone who's been on medication for years, it may take them years to get off the medication. Although not everyone has difficulties coming off antidepressants, I should add, but quite a lot of people do. So it is important to be careful, to take it slowly and to titrate the rate of reduction to the level of withdrawal symptoms that you're experiencing. And hopefully this sort of slow, controlled reduction will reduce the risk of getting these prolonged post-withdrawal problems that some people report. And then the other thing is to think carefully about the other support that you're going to need when you're going through withdrawal. So most psychiatric drugs suppress or alter our normal emotional state, so that when we come off them, we are likely to become more emotional. And that can be difficult. It can be difficult personally, but it can also be difficult for those around you. And so it's really important to discuss what you're doing with your family and your friends and those who are close to you. Make sure that they're aware of what you're doing, and hopefully they will be supportive of it and support you during those difficult times. And it's important to think of other ways that you can manage those emotions, which probably might be really intense for a while because of this rebound effect, because they have been suppressed by the drugs you've been taking. They can often come back with renewed intensity, and which will settle down eventually, but can be difficult at first. So finding ways to manage those emotions is really important. Things that other people find useful are exercise, meditation, relaxation, any sort of hobby that maybe doesn't involve too much intellectual power, but is something that people can engage in, and it is a sort of form of mindfulness almost. So those are my suggestions to people. I think people shouldn't be put off coming off their medication if they conclude that it doesn't seem to be helpful to them, or that they're experiencing more negative than positive effects. But I would urge people to do this carefully and not rush into it.